When working to fully understand acute care, it is essential that we become knowledgeable not only on each discipline involved, but how their roles come together to work as a cohesive interdisciplinary team. When working in an interdisciplinary team, each staff person involved provides a needed and valuable service to overall patient care, as well as brings forth a unique skill set that should be respected and heard throughout the process. It is important to recognize each person of the team, their ideas, thoughts, and skills throughout in order to ensure that patients are receiving the best care possible. As we know, one of the main roles within an interdisciplinary team in acute care is often occupational therapy. OTs focus on a person's ability to participate in their desired daily life activities, or sometimes otherwise called occupations. They may work in a variety of settings, including inpatient, acute, inpatient rehabilitation, long term care, nursing facilities, schools. As we know, the scope is truly endless. But within acute care, OTs often include a combination of interventions that target improving physical abilities to safely perform daily tasks, the incorporation of adaptive equipment to complete ADLs, IADLs, self cares. Sometimes they work on modifying the home or environment, or even just changing activity patterns and behaviors to lead to a higher level of function for each client. Occupational therapy services regularly include educating clients and families and building meaningful relationships, as well as sometimes educating other members of the interdisciplinary team on strategies to support these goals and treatments. When going into each session, OT has specific goals that they create in order to make sure that each session is as meaningful to the client and as efficient when working towards obtaining their optimal recovery and overall success. An OT's goal is always to make sure that the client is as independent as possible. The next member of the team that is often included in which OT works very closely with is physical therapy. In the acute care setting, physical therapists focus on a lot of functional mobility, lower body strengthening, balance, sometimes wound care. Physical therapists diagnose and provide interventions related to movement dysfunctions to, that promote a person's ability to move, minimize disability, decrease pain, and most importantly, restore their functional abilities. Although PT focuses a lot on mobility, they also work really closely with OT as a part of the interdisciplinary team to optimize patient outcomes. OT and PT coordinate and collaborate to address the unique needs of patients while supporting each other's plan of care, respecting each other's goals, and working together to lead to the most optimal success. Another member of the team that is often utilized in acute care is speech language pathologists. SLPs in the acute care setting carry out evaluation and treatment of swallowing disorders, cognitive deficits, speech and language difficulties resulting from sometimes neurological, sometimes respiratory diseases, and other medical conditions and complications. SLPs provide a wide variety of interventions, including dysphagia management, completing and interpreting swallowing exams such as the modified barium swallow studies and fiber optic endoscopic evaluation of swallowing to evaluate a patient's swallowing mechanisms. Based on the results of those studies, SLPs determine a patient's food and liquid texture needs for safe swallowing along with appropriate positioning during self-feeding and drinking. They often work very close with the nutritionist as well to ensure that clients are meeting their caloric intake and that their swallowing difficulties are not interfering with the nutrients they need in order to live a healthy life. In some settings, OTs often also assume the role of dysphagia management, often due to limited speech therapy services or sometimes just because occupational therapists can be specialized in that. OTs work in conjunction with SLPs to address the mechanics of feeding and eating all the time, as well as other things such as utilizing adaptive feeding tools, scooping items on a plate, and bringing items to the mouth for consumption. Eating, as we know, is an extremely important ADL to almost all patients that we will see, and because of that, OTs and SLPs work greatly together, as well as the ability to communicate is also huge. So for an SLP, working on swallowing, speech, and their nutritional needs greatly impacts the results that you're able to see from PT and OT and just what the interdisciplinary team can offer as a whole. When looking at our case study here today, Pamela is a 75-year-old female that presents to the acute care hospital following a fall at home. She has not sustained any injuries, however, has gotten weaker due to her chemotherapy. As we know, Pamela has lost over 20 pounds. She is having a lot of difficulty swallowing. She's able to swallow, but just assumes that it is hard, and she struggles a lot with her IADLs and ADLs. She is also experiencing a lot of fatigue. So, as we described the roles above, it looks like each member of the interdisciplinary team could greatly help her here. When looking at the actual intervention and treatment plans, it's important to remember that going into a treatment session, each profession and their goals and thoughts is greatly valued. So it's essential that each profession as an individual has their own goals before going into the room so that one does not become prioritized over the other. For Pamela, when looking at OT, things to consider when looking at feeding especially could be incorporating proper posture, utilizing adaptive utensils and cups, as well as working on grip strength, in-hand manipulation, also her pinch grip, just anything that could assist the SLP in having better luck with the feeding and assisting her in better manipulation of her feeding utensils. As the SLP, proper swallowing mechanisms to avoid choking or aspirating would be extremely important when looking at the ADL of feeding. Dietary modifications, as well as working with the dietitian to increase caloric intake, and putting a focus on the delayed swallow and coughing that she's experienced throughout meals. As for the PT, when they are involved in the interdisciplinary team and the session is specifically on feeding, they could do a lot of the proper posture and ensuring that how their body mechanics are set up or their ergonomics is set up is not interfering with their ability to properly swallow, enjoy their meal, and reach their caloric intake for the day. When looking at their basic ADLs such as bathing, toileting, hygiene, dressing, or self-cares, and Pamela, as an OT, the first thing that comes to mind is definitely energy conservation, the use of adaptive equipment, and fall risk. When considering energy conservation and incorporating things such as banking and budgeting throughout her day, it would greatly benefit her and minimize the amount of fatigue that she is feeling, as well as most likely minimize the amount of fall risks. Beyond this, utilizing adaptive equipment for dressing and hygiene and bathing could greatly increase her independence within the home, as well as minimize her fatigue and minimize her fall risk. For each profession involved, but OT especially, educating her on the little things to minimize fall risk will also be extremely important. PT can work on a lot of postural control and balance when looking at ADLs and IADLs, as well as maybe some home modifications that could assist her in utilizing proper gait mechanics, transfers, maybe the incorporation of a front-wheeled walker, as well as OT could look at possible incorporation of grab bars or moving furniture, any type of assistive tech or assistive equipment that could allow her to use her cognitive and speech abilities to minimize the amount of fatigue that she feels throughout the day and to increase her overall independence. Lastly but not least, her pain management or her pain that she feels following chemotherapy could also be a large focus for both OT and PT. Incorporating some mindfulness techniques, breathing exercises, and the education on PAMS and maybe ultrasound or heat modalities could assist her in not only helping with the chronic pain, but just relaxing in general. A PT could also work with the OT to come up with a at-home exercise plan that would allow her to get some type of moderate level of exercise to decrease levels of pain. This could include yoga, tai chi, or maybe some light to moderate strength training. Lastly, as we know, within working on any team, communication is extremely, extremely important in order to yield the most therapeutic results possible, as well as avoid possible misunderstandings or conflict throughout. Having an open communication between all therapists involved will be extremely important, as well as understanding that each role needs to be clearly defined and communicated prior to the treatment, as well as have their own goals established so that one not one discipline gets left behind. Beyond this, it's essential to utilize the team approach and draw on the strengths of each member during the co-treat sessions for optimal patient outcomes. Throughout the co-treat, it's also important to remember that each profession is an equal. Each profession will be talking and speaking and educating on whatever their session is about, as well as following the treatment session. The interdisciplinary team should communicate to discuss how the session went, what could be worked on in the following sessions, and who is responsible for each task that will need to be looked at within the next session. An interdisciplinary team is one way to bring forth multiple people with multiple strengths and put them all together in order to really treat the patient in the best way possible and bring forth the most results that we can in order to get them back to their prior level of function.